Hello everyone, my name is Dr. Hussain Muneer. Currently, I'm working in First People Hospital, Zhejiang, China. I'm a part of California Institute of Research and Technology, and I would like to thank Dr. Barney for giving me this opportunity to take part in this symposium and represent my poster presentation. So today I want to talk about one meta-analysis and review topic, the clinical impact of intracardiac echocardiography in cryoballoon ablation for atrial fibrillation, a systemic review and meta-analysis. The background: the clinical outcome of intracardiac echocardiography guided contrast-free cryoballoon ablation for atrial fibrillation show promising potential. Through further research is needed to fully understand its effectiveness. The aim of this study is we want to compare the IC-guided contrast-free cryoballoon versus conventional fluoroscopy cryoballoon ablation strategy for atrial fibrillation. For this, we use electronic database and like Medline, PubMed, Amabase, and Google Scholar were systematically searched for this study, comparing IC-guided zero fluoroscopy CBA and non-zero fluoroscopy CBA, that is conventional. In this study, our main goal is we want to compare the use of IC-guided cryoballoon ablation and non-IC guided, like where we use the fluoroscopy. So result in this meta, we include 10 studies involving 2,724 patients were analyzed in this meta. There was no difference between A groups in terms of recurrence from atrial arrhythmia, and risk ratio is 1.1 and 95% confidence interval 1 to 1.2, and p-value is 0.05, that is significant. But here the heterogeneity was 44%. And the same, like there is no difference between procedure time and fluoroscopy time and major complication. But IC guided cryoballoon ablation, where we have significantly reduced the contrast media. And also, if we do the sub-analysis, that reveals that IC guided CBA approach significantly reduce the procedure time and fluoroscopy time. If so, and we, okay, let's briefly talk about the introduction about this. The most prevalent clinical relevant heart rhythm abnormality is 20th century is atrial fibrillation, which regarded as an epidemic of cardiovascular disease. Atrial fibrillation puts a significant strain on healthcare system due to its higher rate of morbidity and mortality. The number of people living with AF increased significantly from 33.5 million to 59 million worldwide between 2010 to 2019. And significant source of ectopic beat that cause recurrent proximal atrial fibrillation is pulmonary vein. That is the main origin of this arrhythmia. Recently, in treating proximal atrial fibrillation, several trials have demonstrated that cryoablation is very successful and efficient. Achieving pulmonary vein occlusion with cryoballoon is the fundament of a successful pulmonary vein isolation. However, operator and paramedics in the cath lab face unique health hazard related to radiation exposure. Employees are more likely to develop number of illness over their lives, from cataract to cancer, because these radiation damage have many hazard effect, and it is the most of the side effect from cataract to they can lead to the cancer of the most of the head and neck related. The use of iodinated contrast medium is limited to risk of contrast-induced nephropathy. This is also one limitation of the conventional cryoballoon ablation. And also in CKD patient, we can't use this contrast media. And also in the patient who have adverse reaction with the contrast allergy. So in this study, we want to compare the efficacy and efficiency of this IC-guided cryoablation, where we not use the contrast media, where we not use the radiation. We just used intracardiac echocardiography and minimum exposure to radiations, as well as minimum use of contrast media. That is benefit to lowering the fluoroscopy duration, radiation exposure. Both this will give beneficial for both doctors and related paramedics, and as well as for the patient. And also contrast dye consumption. We consume less and less contrast dyes. Hence, a systemic review and meta-analysis were conducted to assess safety and efficacy of these strategies. Method here for data source and research strategy, I already talked about. We mostly use the on electronic databases, and the from November 2010 to October 2023. So these are the time duration where we extract this study. In this my meta, I including 10 studies from different all over the world, different countries. And for the search terms such as atrial fibrillation, we use this keyword on PubMed or the other electronic databases, and intracardiac echocardiography, IC, cryoballoon ablation, CBA, contrast-free cryoballoon, contrast-free CBA, conventional fluoroscopy, cryoballoon ablation. So the analyses were conducted following the preferred reporting items for systematic review and meta-analysis PRISMA guidelines 2009, and was approved by the local institute review board. And we also have some inclusion criteria as well as exclusion criteria. So let's talk about the graphical representation of my this meta-analysis. First, I want to talk about the free patient from free from the recurrence, like they are freedom from the recurrence rate. So here in this first graph, the left side, the study and subgroup, there are the 10 studies which are conducted in all over the world. And I mentioned the first name, that is the author name, and then with the author name, I mentioned the year, the what time the studies were conducted, and then the events like how many patient is free from the recurrence and with the IC, and the right side without IC, like where we use the fluoroscopy, and with IC we use the intracardiac echocardiography, and without IC we use the fluoroscopy and contrast media. And the left side risk ratio, these are the risk ratio and 95% confidence interval, and on the right side also the graphically show the lines, and these are the bars and the point at the and the at the end of this graph show the total in total 95% confidence interval, and the total pool of this meta-analysis, what we extract, what we see here actual result of meta-analysis, like a pool study. So here there is no significant difference between IC and without IC. The diamond, the last at the bottom of this graph, the diamond show this diamond touch the central line. That means there is not a significant difference. And here is the p-value is 0.05. That means this study is significant good. And the heterogeneity is 44%. What the means of heterogeneity? These are the like these the difference between the two between these studies, like one study is telling about something related to IC, and another study telling about some variations, like what extent between these two studies and how the variation among these two studies. The procedure time, the second graph is showing about the procedure time. Here also the black big diamond, like the total pooled of this meta-analysis, they also cut the central line. That means there is no mean difference, like there is no significant difference between these studies analysis, what we analyze. And here the result is 9.21. If we excluded this Janis 2023 and the Costin 2021, these two study, if we exclude from this meta, and then this is the sub-analysis, like if we want to check the sensitivity of this analysis, if we exclude these two studies from this analysis, this show significant improved, like this study will gonna favor the IC guided approach. The third one is fluoroscopy time. And here also, from this fluoroscopy time, if we exclude the Janis 2023 and also the 2021 SkipMet, these two study, if we exclude from this graphical representation, if we remove these two study, and the graph again favor to the IC. These are the two graphs which I am talking about the sub-analysis as, like I want to talk about the sensitivity of this graph. So overall the result, let's talk about Our best knowledge, this current study was the first meta-analysis to investigate the clinical outcome of IC-guided contrast-free cryoballoon versus conventional fluoroscopy ablation strategy for atrial fibrillation. The main findings as follow. IC-guided CBA show similar success rate for maintaining SR for atrial fibrillation as compared with conventional CBA, combined with similar incidence of procedure complication between groups. Like IC-guided CBA might help to reduce the need for repeat ablation. Like most of the patient is free from the freedom from the recurrence. With the help of IC, we can properly locate the balloon around the pulmonary vein posterium. We were able to confirm the accuracy. We were able to confirm the accuracy of PV occlusion. Detection of failed PV occlusion was easily and accurate because saline leak around the balloon show micro bubbles entering into the left atrium. The presence of flow around the balloon would promote the operator to immediately adjust the balloon location without spending more time injecting for IV contrast repeatedly until occlusion is present, likely resulting in shorter procedure time and contrast media use. So this way, by this approach, IC guided, we can reduce the contrast medium procedure time as well as freedom from recurrence, and also the significant reduce the radiations, and also this is benefit for the both patient and as well as doctor. So in one study, as shown in Maloof, like in one study was conducted, so the intravenous contrast volume reduced significantly from 75.4 to directly only 16.5. There is a huge difference, a significant difference between these two studies. There is very less without with IC guided, we use very less contrast media, only about 16.5 ml whole procedure. But without IC, we use 75.4 ml contrast media, as well as the radiation also have too much. We use too much. So patient with severe contrast media sensitivity or renal impairment will especially benefit from the lowering radiations as well as contrast media. A notable finding was that in potential life-threatening cardiac tamponade current occurred significantly less frequently in procedure where intracardiac IC was used. So if during procedure, this cryoballoon procedure, if anything like any complication happen, we can diagnose that complication at the same point, at the same time, as well as we can manage it. And with the help of IC guided, we can properly locate the balloon as well as the whole structure of the heart. And also the benefit, there is no radiations and less radiations exposure as well for the both paramedics, doctors, and everyone. So the result conclusion about our study, this IC guided cryoballoon ablation technique is feasible and safe and show the potential to provide complete contrast free cryoablation. The IC guided approach was effective and less invasive in terms of reducing the use of iodinated contrast and radiation. So these are the conclusion and these are the result of our study. I hope you guys understand it and enjoy this our study. And I would like to thanks Dr. Bernie and my professor Shuichu who gave me this opportunity. I complete my this study and I present in this symposium. Thank you.